Back pain can be debilitating, crippling, and make what were once easy things in life a lot more difficult. But there's a way to trick your body into relieving the discomfort. Take a look. For millions of Americans, back pain is a fact of life.
Back pain itself is one of the largest problems that we have in the United States. Back pain accounts for more problems than sometimes cancer and other disease processes combined.
And it's something 70-year-old Martha Jean Savage is all too familiar with.
And as long as I laid in a recliner, I was fine. The minute I stood up, I was in terrible pain.
For years, Martha Jean lived in agony. The pain would start in her leg and radiate up her spine, making even simple things like walking difficult.
When you don't have the mobility and you feel it beats you down after a while.
Martha Jean tried cortisone shots, medications, and other treatments, but they only offered temporary relief.
Let's see what we got here.
That's when her doctor, Dean Mariano from Midstate Medical Center, suggested a little-known solution, a spinal cord stimulator to block the pain.
So if you think about it, kind of almost like a pacemaker for a heart. Pacemakers for hearts can send electrical impulses to the nerve bundles of the heart to allow it to beat and function correctly. Well, a spinal cord stimulator works similarly to that.
In a simple surgical procedure, the spinal cord stimulator is implanted under a patient's skin near their spine. It works by delivering mild electrical impulses that travel from the device up through the wires implanted in the spinal cord.
What the spinal cord stimulator does is it interrupts that signal track going to the brain, and we're replacing it with a different type of signal. So instead of feeling sharp, burning, tingling, electrical fire, you might be feeling a massage sensation or a mild tingling sensation that is not painful at all.
Essentially, the device outsmarts pain by blocking pain messages before they can even reach the brain. For Martha Jean, relief was immediate.
Right away, I had no pain whatsoever. I got up and walked out of the hospital.
The beautiful part about the device is that she has control over it.
Using a remote control, Martha Jean can make the pulses stronger or weaker, turn the device on or off, and recharge it by placing a paddle over the area where it's implanted. For her, the spinal cord stimulator has changed her life.
I can do things now that I have not been able to do for quite a few years. I can interact with my whole family, with my grandchildren, work in my yard, ride a bike, go for walks, which I could never do before.
And now she can look forward to many more pain-free years to come. Now, with the device, Dr. Mariano says the right candidate can experience a 50 to 75% reduction in pain, but before someone can have a spinal cord stimulator implanted, they have to go through a thorough assessment, including a 4 to 5 day trial period to see if the device will work for them. And of course, for more information about this treatment and other details, log on to midstatemedical.org.